Take it. Go take it.
Sorry about that.
Faye.
Good evening, we're live on YouTube. I'm Faye D'Souza. Thank you for joining me. This is our daily evening conversation about what's going on in the country and what's important and what deserves your attention. For our viewers who are joining in, remember you can support us financially as well by using the super chat feature that's at the bottom of your chat window. Also at 9 o'clock, I'll be back with a one-on-one Ask Me Anything, and we will discuss the important stories of the entire week. And I look forward to having that chat with you, answering your questions. But today we have a really important conversation to have. India has now crossed 5 lakh total cases of COVID. We've reported again, as we do every day, the highest single day spike of over 17,000 cases. This is the first time we've added more than 17,000 cases. And if you look at that spike right now, which is on your screen, you'll notice that it keeps getting higher and higher every day. Maharashtra has over 5,000 new cases. There's West Bengal, Tamil Nadu also adding to that number at this point, in Delhi, which is now crossed Mumbai to be among the worst hit cities. Overall death count is over 15,000, with 407 new fatalities being reported in a single day. For the 7th day in a row, India has registered more than 14,000 cases. Delhi, Chennai, Thane, Mumbai, Palghar, Pune, Hyderabad, Rangareddy, Ahmedabad, Faridabad, 10 cities and districts that have contributed 54% of the total cases in the country. And like I told you, Delhi earlier this month overtook Mumbai as the worst hit city in the country. So the questions that we're asking right now are these: is India anywhere near the peak of COVID cases that we're adding right now? Because from that chart that we looked at, you can see that that number seems to keep rising. Effectively, we've seen in other countries at some point, the total number of cases added per day starts to reduce, and that's when their slump comes in. Second question that we're asking is, are we headed to another lockdown? Is that the solution, or is there a different solution at this point? And the final question is, at 5,910 tests per million people, is India testing enough? These are the questions that we're asking right now. To help me answer those questions for you, we have Dr. Tanmay, who is an epidemiologist, joining us right now. Ravi Duggal is a public health analyst, and Dr. Shruti Tandan is the intensive care specialist at Jaslok Hospital, who's working on the front lines of COVID, will join us in just a moment. I understand that she's currently on duty. So the gentlemen are with me right now. Good evening, and thank you for joining me. Dr. Mahapatra, you are the epidemiologist. Are these numbers that you were expecting? Are these numbers alarming you at this point? At 17,000 new cases being reported every day, are we close to the peak at all, Doctor?
Good evening. First of all, while talking regarding the current scenario, I believe these numbers were quite expected as per the epidemic curve, because if we remove the initial days for any kind of pandemic, we generally find a certain pattern in the epidemic curve. And given the current situation in corona pandemic, across the planet, every country had a scenario when we actually entered from the sub-exponential growth to the exponential growth. And this is the time when things actually start to worsen every day than the previous day. And by that time, we see the curve going upwards in a kind of a peaking manner. And this is somewhere we are right now. But the fact is that we are not yet probably close to the peak, because we generally see in a kind of a pandemic curve that the slope of the curve goes first from sub-exponential to exponential, then that graph becomes steeper, And we are in that steeper scenario. If we see that what amount of time did it take in having the last 1 lakh cases, we will see that the days are decreasing. That last 1 lakh probably happened during last 6 days, where it was before more than that. So gradually we are testing more than before. So we are identifying more cases definitely. But this is also the fact that whatever we are seeing, that is a part of the total number of cases, given the kind of asymptomatic and mild symptomatic cases are there in the society and around. So given all the states right now having some kind of upward graph, probably we are heading towards the peak, but it's not, we are not in a situation to say that we are already there. That is number one. Number two, the upcoming days, how fast we will reach up to the peak, it depends on the susceptibles, because ultimately, as long as all the susceptibles are kind of exposed, or we are in a situation when we have controlled the chain of transmission, either of them will take care of the scenario when we'll start flattening. And given the current situation that we really don't know what is the asymptomatic transmission scenario, because we have seen several debates around that, and debates at least tell you that you don't know the truth, and it's very tough. We are dealing with a viral pandemic about which we don't know much. So I think August will be somewhere we'll be seeing the worst, and we expect to see post-August in September the steepness of the graph to go a little on the downside, but that does not mean that it will be over in such a short period of time, because whether it gets flattened or whether it actually goes into a downward trend, still we don't know whether the virus can change its behavior. Given monsoon is here, given we will have change in temperature, as well as there are all the things where relaxations going on, how community behavior is actually going to alter the graph in that way. So these numbers were quite expected. They are going upwards. We are going towards peak, but we haven't yet reached there.
Right, Dr. Shruti Tandan joins us as well. Dr. Tandan, it's always nice to see you looking well. Thank you for the service that you're giving the country right now, you and your team. I must ask you, there's a lot being said about herd immunity in this opening up of the lockdown, that basically we'll open up the lockdown and all the young people will go out. And I've actually been told this in the last couple of days, that we will achieve herd immunity because that's the only way to go forward. Do you agree?
No, not exactly, because see, for herd immunity, you need a certain critical amount of patients to get infected. And if herd immunity was the way out, then we shouldn't have had the lockdown at all. So once you have 60 to 70% of your population affected, and there will still be a lot of young people who will become critically ill. So we are seeing this increasingly, that there are a lot of 30, 40-year-olds, there are even people in their the second decade of their life, which means under 20, who are getting seriously affected. So really, there's no age group. The number of people getting seriously ill in the older age bracket is definitely higher, but there's no age which is safe. So to go out and welcome the virus with open arms is definitely not the way forward. But yes, I do understand that opening the lockdown is probably, we've had it for too long. But I would still urge people to go ahead and follow all the precautions, because though our doubling time has come down, and that is a big relief. Okay, from it's gone up to as much as 23 days, and it's also reassuring because we are not seeing such sick patients as we were seeing a month ago. I'm also much relieved. So you again caught me in my COVID week. But this has been a better week because I have offered beds to everyone who's put in a request, and people have found beds elsewhere if they've not come in. So it's not such a bad scenario. Probably our mismatch between the healthcare services and the number of sick patients has improved, and that may also to do with the fact that we're not getting such sick patients now.
Dr. Tandan, when you talk about the doubling rate and the fact that beds are more easily available, you are referring to Mumbai specifically.
Yes. Okay, now one of the things which, bringing credit to that is the fact that the government capped, their charges in hospitals. And if you look at the rates, the charges that it's come down to, it's very affordable by everyone. So 80% of the beds are now capped at 8,000 rupees a day, which includes the bed charges, the ventilator charges, oxygen charges, the doctor's visit charges, the basic investigations and treatment. So it's really come down to a very affordable care. So people are now going in for private hospitals. And from this week onwards, we are also having a centralized allotment of beds, which means I can't take a COVID-19 patient, even if they are known to me, unless they apply through DWARD. And DWARD sends us a request and we're happy to accept. So I think the system has become smoother.
Right. Dr. Mahapatra, quick response from you as well. Do you believe that herd immunity is a way out?
Whether we believe or not, whether we depend on that or not, ultimately we have to depend on it. Because in a country like India, where a real lockdown, the strictest lockdown, maybe the biggest lockdown on earth, ended up in having almost everything going on up to a certain extent. So the point is, we have to understand that lockdown actually is to buy some time for having your health system response more robust, to understand the epidemic much more through serosurveillance and other kind of studies. And number three, to have your population more aware and better prepared for such a response where you can live with corona. So in these three scenarios, whatever we have done, we have done. But ultimately, herd immunity definitely is something where we have to reach, as long as we are not getting a 100% efficacious vaccine, which is ready at the market for everyone, which I am not seeing anywhere a possibility very soon. So we definitely have to think about how herd immunity can be achieved, and with minimum casualty. And herd immunity does not mean that you open up everything, start having all kind of public gatherings, and people get infected so fast that the herd immunity is reached so fast, because all these things are actually practically not a humanitarian approach that we can think of. And on the other hand, we really don't know whether getting once infected by the virus ends up giving us uh, immunity for that lifelong or at all. Because there are reports, of course, not clearly supported, regarding those who got infected once, got cured, they got the disease again. So these are reports which are unsupported, about which we are not always sure that whether things are happening, unless we have a clear idea about the antibody response. And after that, once somebody develops antibody, how long that person is actually remaining immune to the disease, etc. As long as we don't know this, talking about herd immunity as what efficiency having inbuilt into it, we cannot talk about. But definitely herd immunity itself, nature will take care of itself. Because number one, I spoke about this before also somewhere, that we are dealing with coronavirus, novel coronavirus, which is somehow looking to be a very intelligent virus. And what do we mean by this intelligent virus? There is something called viral fitness. Viral fitness means how fit the virus is to survive. The virus also needs to survive. That virus don't need themselves to kill all their hosts. So this virus is actually infecting everyone and not being detected easily, because they have higher infectivity but lower pathogenicity. Infectivity means if you are exposed, how likely you are to get the disease. And pathogenicity is if you are getting it in your body. Sorry, infectivity is if you are exposed, how likely you are likely to get the infection within you. And if the infection is there, how likely you are going to have the disease, that is the pathogenicity. This disease having higher infectivity whereas low pathogenicity. So it is there. It is surviving within the body of the human being. And human being is also surviving with the disease for a certain period of time, unless complications there, people getting cured. So one way herd immunity is going to take care of this whole scenario, but we have to be careful about the fact that this does not mean that life is back to normal, or maybe forever normal has changed. Probably forever we will depend on Namaste 10 second. So we have to be sure about that.
Yes. In fact, I'm going to come back to these three things that you pointed out we should have done in the lockdown, which is improve our health system, prepare the population for precautions, and study the nature of the virus. But before that, let me just bring in Mr. Duggal on the point of improving the health system. Mr. Duggal, even if we consider 10% of India's population getting the virus, in order to achieve this herd immunity, we're talking about 136 million people. Does our health system have the ability? And out of that, even out of that, if it's 20% of those people are going to show symptoms, does our health system have the ability to take those kind of numbers?
Yeah, broadly, I mean, we are a grossly underfunded healthcare system. I mean, at least the public health system. And we certainly don't have the capacity to handle that kind of numbers. So once, if at all we get those close to those numbers. But if you look at global experience, it's very clear what Tanmay said, that we are going to keep growing in the number of cases, number of deaths. If you look at what's happening in the US or the Europe, the resurgence in Europe that we are seeing of recently, the second wave that's come to Europe. So we are going to see increased number. There's no doubt about that. Whether we see many more critical cases, I'm not too sure. But if we do have many more critical cases, then certainly our public healthcare system does not have the capacity to respond, and we need to come much more harder on the private healthcare sector to respond under public domain. So the government will have to start looking at the private healthcare sector to bring in more beds and providers so that they can deal with the situation. So overall, we do have the number of beds. We have nearly 2 million beds across the country if you take the private and public health sector together. So that's not such a great issue. But provided we have the political will to rein in the private sector. So I think that's a larger question. But the public health system is very underfunded, and we need to raise more resources. And we don't see any evidence from most of the state governments or the union government in terms of providing more resources to ramp up the public health system. I mean, we should have.
Mr. Duggal, let me just take you through the numbers. 10% of our population would be 136 million people, and 20% of those being symptomatic, because we understand, according to the health ministry, 80% are not asymptomatic. 20% of being symptomatic would be 27 million people. We have 2 million beds altogether, public and private sector together. So 10%
yeah, but then,
what we need.
well, all 27 million will not need the bed at the same time.
At the same time,
it'll be cyclical. And so what proportion needs it on a daily basis? Probably, I don't think the numbers will go that high. But even if they do, I mean, I think within the 2 million beds plus the quarantine centers which are being set up in stadiums and other places in non-hospital institutions, we would have that kind of capacity.
Sure, that's good to know.
But I think the main question is whether we are able to bring in more resources for the health sector, especially the public health sector, and strengthen primary health care. Because once it spreads to the countryside, to the rural areas, to the smaller towns, where the health systems are much more weaker and less capacity, I think that will be much more of a danger that we would see with the greater community infection happening. So it's already at the community level. We can't deny that. In most states, we are seeing community transmission. So the governments cannot deny that. I mean, Kerala may still be saying there's no community transmission, but I'm sure it is happening. And we are, I think, also what the numbers that we see in India are probably underreported because we don't have such a good health information database. Though what COVID-19 has done is that we're getting real-time information for the first time on one disease. I hope we get it for all other diseases like tuberculosis, malaria, diabetes, heart disease, etc. So that I think it can become a good basis for improving a health information system.
Right. So that
planning
brings me to the next question. And our next question for this conversation is, are we headed towards another lockdown? Is that the only way out? Because I was having a conversation with the doctor a couple of days ago. He called it the SMS method. And I'll take this to Dr. Tandan. The SMS method being sanitize, mask, and social distancing. we're seeing everything open up, Dr. Tandan. I'm a little confused about this because we locked everything down when we had a couple of thousand cases. Everything is opening up now when we are at 5 lakh total cases. SMS is the only way forward? What would you, or should there be another lockdown?
I'm not sure if it's going to be feasible to have another lockdown. It would have been ideal to have a staggered opening. And as you can see that, the government is retracting on a lot of things like the railways and the international flights. But I think what was pointed out previously that the lockdown, should cover 3 areas. One is preparation of the healthcare system, which again we didn't do amply, but okay, probably the strategy of roping in the private sector at least has worked for Maharashtra, and I think that's where Delhi is failing miserably, because you see those horrific stories of 1 lakh rupees a day for a bed, and know that they're talking about Delhi. And the second is public awareness. I think that was what the lockdown was supposed to be used for. Unfortunately, our public is, I don't know, we're a unique species. We somehow shying away from it. We all think we have some kind of providence tailored specially for us, and we are not going to get the disease, somebody else can. So I think if we are not able to, if you're not able to put into a lockdown, but at least the SMS measures need to come down as radically as the government came down radically on the private health sector. And there was a time, I said this before, where it was a crime to be caught. I mean, it was punishable for you to be caught on the road without a mask. And now you see people moving in and out, and a lot of non-essential services opening up, and nobody's really following the rules of the opening lockdown. So I think if the government comes down hard on that, we could curtail the rise in the numbers.
Right. Dr. Mahapatra, do you agree that the SMS method is the only way forward, but it has to be enforced with an iron hand? I'm a little worried about how our police enforces anything in this country, but should we be enforcing it harder?
First of all, we have to understand there is no only solution for a pandemic. And we need to take this pandemic as a lesson, because none of us have seen 1918 Spanish flu. So the service providers, the users, the sufferers, and the beneficiaries, all together we are in a situation which is unprecedented. And in this situation, we have to actually really learn from today to have a better tomorrow. And this is not something philosophical. This is something we have to do. For an example, if this meeting would have been happening without the reason of pandemic before February, we probably wouldn't use Zoom or something for the discussion, because we always prefer for in-person meetings. But still today, we people are talking over digital aspects in a digital platform in digital India. So we need to learn how to live with the minimal aspects. Now, what Dr. Shruti was referring to just right now, this opening up of non-essential services, these are kind of mistakes that we must not be doing right now if we are actually inclined someday to back to a normal, even if it is a new normal. Because there are several things beyond which a lockdown can go. We cannot have in a country like India lockdown for years or months. We have to have, we will get back to the lockdown discussion you already mentioned. The point is, community awareness and implementation of self-management and proper prioritization is the need of the hour. We need to prioritize what we have to do to survive, to ensure that the less prioritized and proper judiciously done prioritization and optimization. And I'm not talking about only individual level. I'm talking about individual level, I'm talking about community level, and I'm talking about health system level. We have to optimize. Just like we were discussing about 27 million or 2 million, there is also this optimization of the requirement of bed utilization. We have to have the rationalization at all level. Our COVID scenario, if we think about how much, what is the mortality or fatality because of COVID, there are several non-COVID fatalities which are being not that adequately addressed right now, given the current situation, because I'm afraid to go to the facility. Doctors are not being in a position to handle all priorities together, given different kind of scenarios, as well as the system is not in a situation. It's an overwhelming shock. We were about to buy land in March, but we didn't. We were not in a situation to handle a viral pandemic. And every time what has happened, health has always had the less prioritized scenario in terms of funding, in terms of its implementation. All these things need to learn something from this COVID scenario, and SMS-based method is one of them. We
Yes.
have to have different kind of awareness generations to have our community not in panic, having more resilience, not resistance to different kind of governmental processes of surveillance and other stuff, as well as somehow we have to reduce this stigma. This stigma is killing our country right now. Everybody everywhere are afraid of getting tested, because if I become positive, then I'll be in a situation when our family will be thrown out of the community. So it's if there is a case next to my house, unless that person is compelled to sneeze on my face, there is no likelihood that I am actually going to infected by that person if we follow normal personal hygiene and other stuff as everybody is supposed to do. But what we will do, we'll make it a Sansani case coverage. Okay, we have a case next to my house, so there is all kind of. So we have to take care of this stigma thing right now, and for that SMS, all kind of media messaging with proper articulation is very important.
It's very well said. I just want to move to my last question on this conversation, which is that right now India's numbers are we're testing 5,910 people per million. Now, this is still not very adequate in comparison to the rest of the world. It's much lower than other countries. But we must remember that different states are testing more than the others. We also know that different cities are testing more than the others right now. Ravi, Duggal, is there a problem with testing in your opinion? Should we be testing more?
Definitely, we should be testing more, because if you look at countries which have, like for example, New Zealand, which has actually overcome the crisis to a fair extent, they tested something by the time they finished with the thing they were testing more than 70,000 per million. So so they were clearly much ahead, and many of these countries, European countries, etc., are around 60 to 70,000 per million, and we are far away from that figure. So we definitely need to test more, to contact trace, and be much more active in testing. So we have to ramp up our testing facilities, I think 10 to 20 fold. Otherwise, we are not going to capture the entire kind of infections that are happening within the community. So we need to be, and once we do that, we will see that the positivity rate will also come down substantially. So we need to expand that a lot, and especially now that it's spreading into the poorer communities much more. Migrants have gone back, and so on and so forth. So we also have to see that testing is done free, of course, so that there's no burden on any household. So the testing, whether in the private or public sector, must be free. The state has to take care of that.
Right.
So
Dr. Tandan, and I can tell you personal instances of people who were exposed to someone who had COVID or was tested positive, but the government is dragging its feet right now and testing everybody. They're saying, stay at home. If you have some symptoms, then we'll test you. There's, it's not very easy to get a doctor to give you a prescription to get tested either. Is there a challenge with testing in your opinion?
So there were a lot of challenges. Those have improved of late, and it's easier to get tests done. And there are places where you can get tested even if you don't have symptoms, and they're offering tests without prescriptions also, which I agree with Mr. Duggal is a very welcome sign, because only when you test more can you isolate more and contain the disease. About the free testing, I mean, it's very welcome to have free testing, but the actual cost of the test is very high. You don't want something to become a sink test. Just because the government has said that you must run the test free people will start handing out any kind of reports. So while it's fair for a person with the BPL card to have a test at a discounted rate or free, but then somebody needs to reimburse that. And those were the mistakes which we made in the beginning. And I think that's why we had to we never landed up increasing our testing capacity the way it should have. We would have had this testing capacity maybe 2 months ago, and we would be in a different scenario now. But at that time, we came very early in the pandemic, we came out with this rule that everybody who's BPL must be test free. And I don't think that's fair unless the government is reimbursing it or you have enough testing happening in public hospitals.
Right. Dr. Mahapatra, what do you think the way forward is right now in terms of testing? Should we be ramping up heavily in India?
Yeah, not now. Long before we needed to test a lot more. The point is only testing doesn't make the full sense. We need to know whom are we testing, why are we testing them, and after testing, what we will be doing with them. So testing needs to be coupled with a proper surveillance system, and then it has to be actually following a proper guideline and protocol. Now, keeping it only for symptomatic doesn't make much sense. Number two, there should be an opt-in opportunity also. If I somehow, there is the whole world uses self-perceived morbidity as one of the important indicators. So if I feel somehow that I want to get tested, I should have an option. Now having a doctor's prescription and after that having different kind of filtering methods for testing to be done or not, that was very good when it was in the initial situation when we didn't have the testing opportunity or the testing capacity. But right now we really have to have a way to ramp up the testing, because the more we test, the more we understand where are the new spots, clusters, and all those stuff. From very start, we did have all the hotspots identified as bigger areas. And that actually ends up in having the idea of having these smaller containment zones or nanospots, whatever we call them, because this is a disease which is known to actually being transmitted through close contacts. So different families, different familial clusters, people who are at high risk, who are actually kind of in a profession where they actually meet many people at the time, they have to have the testing opportunities. So we have to have a way to ramp up the testing. And number two, we have to have a clear understanding that this is something which we need to handle the human species as a team. This comparison, they are testing more, why you are testing less, or what is actually will happen if we test more. I believe we need to move on from this, and we have to be pragmatic also. Making something free does not include the private sector or other areas in that way. So there will be a proper way of handling all this, and that is not for Corona only. That is as a whole, the whole health system of India. I believe we need to have a proper balance between our public-private system, and there should be a proper pricing theory. And because this is not something the health sector is not something where we can have all the profit making out of any reasoning. And also, it's not like, okay, let's make it free. Everything come at a cost. There is no free lunch principle. So we have to optimize that cost with the need, and we have to keep in mind that we are dealing with a pandemic, an attack to the human race. So
Yes.
for that, we need to ensure that we have a strategy, because this is going to continue. And we are discussing this for long, that whether testing will be free or not. So we have to have a policy right now for that.
I saw Mr. Duggal's hand go up. Mr. Duggal, go ahead.
Yeah, I just want to add to this that apart from ramping up testing, I think we also need to increase the surveillance in terms of doing random surveys so that you know where the spread is happening. So you can actually have a better denominator on the basis of which you can say that, okay, this is the prevalence rate that we see. This is the right time to do it. If we keep delaying it, we're going to miss the bus. And I think that is something ICMR has done a very small kind of survey, but that is not adequate. You have to do a much larger survey because it's really growing rapidly. And so that is something else we need to add to the testing scenario. And so we'll have a better understanding of where the virus is going and how we can plan better to curtail it.
A quick question to all three panelists. I'll start with Dr. Tandan first. Obviously, people are a little nervous right now because everything is opening up. There are more people moving through your housing societies and your buildings. People are expected to go to work, use public transport. What precautions should we be taking? Dr. Tandan. I'm not sure if Dr. Tandan can hear me. Dr.
Yeah, I'm unmuted now.
Yes.
Okay, so see, there is, it would be a good idea, like your SMS method, just the way Dr. Mahapatra said that it can't be the only method. It's a good idea to educate and reinforce these things in the public. And there are norms to safe travel. There are norms to safe meeting in public places, in workplaces, which need to be reinforced from time to time. Okay, like when you travel in a bus, you need to be half the number of seats. You need to sit diagonally opposite to maintain that distancing, need to have the masks on. So we need to even educate our conductors that if people are not having the masks on, you ask them to alight from the bus. You can't have people turn around and talk. So, India being a democracy, we'll end up doing whatever we want. But in China, it was very easy to enforce these things. The same way, when you go to when you go to offices, like I visited one of the D ward offices for some work, for some personal work, and I noticed that on two sides of me, the right hand side, there was an office where everybody had their masks on, all the clerks, and everybody was just looking down and working. And the left hand side, there was no question of mask. People were sitting there eating, talking. And in one office, there can be so much of a difference in the level of understanding of the disease that it amazes you. But you cannot leave these things to chance factor. So while your testing can be random, but your spread cannot be random like that. So I think introducing these at every level, like we have done it at levels of hospitals where there are safe eating practices. Even if you're drinking coffee and you're sitting in a group and having a discussion, then only one person will drink at a time, and the mask goes up immediately. Things like that. You're not supposed to eat lunch with anyone. I mean, these are things which need to be reinforced from time to time. And I think now employers at offices need to take up responsibility of these things. Similarly, practicing, putting in practices into societies, like a lot of societies, including the one I live in, you have to wear a level 2 PP, which means anyone who comes from outside wears a disposable gown, wears a fresh mask, uses a hand sanitizer, and then you come in, you do whatever air conditioning service or whatever you have to do, and that cost of that 200 rupees is billed to the individual who's using the service. So, getting these services and really defining a new normal will help slacken the spread of the disease, which is, I think, the call of the hour. Because no matter how much we ramp up our testing, ramp up our isolation facilities, we can't shy away from the economic burden breakdown, and we will have to strike a balance between the two.
Right. Dr. Mahapatra, a question that's coming from one of our audience members is asking when schools and colleges should ideally open. You talked about the fact that you expect August to really be the worst before it starts to taper. In your opinion, should schools then stay closed till September?
Now, this is something which is very kind of a conflicting scenario, because if we are only opening up everything and only compromising on the educational aspect, that is actually not good. But unfortunately, schools where we have little kids interacting with each other, it is really tough for having all kind of scenarios controlled. So I believe schools need to remain closed for at least up to September. I mean, August, till August, definitely. And we have to actually have a plan where we have the other systems. I know all the online systems and digital system of education going on right now, but that's not that efficient yet, because we are not that cyber friendly, cyber savvy, or the reach is not up to the last mile. So there should be some approach that we can think of, like open door schools or something, if those are possible at some places. We have to check, but definitely it's not time to open up the schools.
All right, so it's not time to open up the schools. I want to thank my panelists, but I just want to go over the things that we've been taught through this conversation to our audience who's asking the question. So if you are going out, these are the things to do. Ideally, eat a drink by yourself. Sanitize, wear a mask at all times, maintain social distancing. Ravi Duggal, I saw your hand go up. Okay, all right, go ahead, Ravi Duggal.
I actually wanted to kind of say that the problem with the continuing the lockdown in the way it's being done is problematic because there's a class bias in it. I mean, who does the lockdown actually benefit? It benefits people like us, okay, who have proper house to stay in, have decent incomes or savings, etc., on which we can rely on. What about the poor who have lost their livelihoods? So things have to open up. I mean, there's no question, but we need to be vigilant about the hotspots and where the regulation needs to be much more stricter. So definitely, I mean, we need to be cautious because, okay, opening up schools, fine. I mean, middle classes can probably afford that. They can have an online access. What about the Zilla Parishad schools or the Sarkari schools, where the poor go? They don't have that kind of facilitation to deal with. So I think we need to look at it from that perspective also, from the perspective of the poor and the majority.
So, Faye, I wanted to add something about the schools.
Yes, please.
So there's this very interesting piece by Soumya Swaminathan, which you'd find online, which she actually tells you that children are very unlikely to spread the disease as much as we fear it. Now, another perspective to this is that if you look at, because I'm also a board member of the school that my children are in, and we are looking at this very closely. So I've surveyed this across different countries of the world, and countries which have open schools actually have 3 active cases. Like in Australia, there are 3 active cases, and that's why my friends have started sending their children to school, and the government has decided to open. We're very far from that scenario, and I completely agree with what Mr. Duggal said, because online schooling is not an option at all. And if you, I'm not even saying that, I'm talking about the lower socioeconomic strata, but even for the upper class, there was a time when we were shying away from screen time, and the effects of screen time showing on the health of children, the neurological health, the sleep disorders that coming up on children was a huge concern with the community, with the medical community. And now, if you look at the pediatricians, they are actually overjoyed by the ruling of the government that online education needs to be put on a standstill. It's all right for the child to miss 6 months of online education rather than be exposed to this kind of device time.
Yeah, this 2020 should be a gap year in education.
Yeah. Actually, and this is something which is just a funda with India. Mera ek saal miss ho gaya and stuff like that. When you travel abroad, you meet people who say, okay, I graduated, then I decided to take a year off to travel. I mean, why not take that time off to learn stuff at home with your families? There's enough to learn at home rather than go onto an online platform and.
Yes.
Absolutely. Kids should be doing housework, learning those skills,
Yes.
Cooking, stitching, whatever.
And I suppose if this lockdown has taught us anything, is that housework is a life skill. You have to learn how to cook for yourself.
Absolutely.
And you have to learn how to clean up after yourself. There's no option really to not knowing how to do that. All right, I'm going to leave it here. I want to thank my panelists for being so kind. Just to go over the precautions, guys, one more time. Just because the lockdown is easing doesn't mean the virus has left the building. It's still here. We're having to just economically, we're easing the lockdown for economic reasons, not for the virus, because the virus has ebbed in anyway, which means the amount of paranoia we had about the virus in week 1 to week 6 is the same amount of paranoia we need to have today, which is sanitize, wear your mask at all points, and maintain social distancing. It doesn't matter where you are. If you're in the bank, if you're in the bus, if you're in the train, if you're in an airport, stay as far away from other people as possible. Assume that, staying close to people is going to give you the virus. Treat everything as contaminated before you sanitize it. So everything that comes into your house should be washed or sanitized. Remember also, like Dr. Tandan said very carefully, do not gather for chai. We're not at that place right now. Do not have lunch together. As far as possible, don't sit facing people. Sit side by side, at a distance from each other, so you're not actually speaking at each other this way. These are the things that we know already. There's a whole other conversation to be had about how little we know about what's happening with the virus in India and how little research we're doing as a country in the behavior patterns of the virus in our country with our weather and our genetics. But for now, we have to use the information that we have to keep ourselves safe. And the more we keep ourselves safe, the more we manage to keep everybody else safe. All right. So send us questions and we will reconvene the panel whenever we could ask more questions. This is what this entire conversation is for. This platform, this YouTube channel is for information. So thank you for joining us. Remember, I will be back at exactly 9 o'clock and we'll do an AMA where we can discuss all of the stories for the week. But for now, stay safe and thank you.